Minister, I was contacted by a GP in Wicklow a number of months ago who wanted to let me know about the difficulties that she was experiencing in trying to refer patients for services, for mental health services. And following that contact, I organised a group of GPs in Wicklow, a representative group, and met with them. And across the board, for every one of those GPs, they all expressed the same concerns to me on the availability of psychiatry services and psychology services in Wicklow. And across the cohort of services for adults, services for children, and services for people with intellectual disabilities. And each one of them spoke about referring patients that had come into them, children, adults, across that group that I described, and that referral not being seen, or there being massive delays, or that patient coming back to their surgery with a condition that had worsened, having not been seen. And that was really worrying for them, and as doctors you can understand that, and they're limited in what they can do and refer people to those services. So I'm aware that this situation predates COVID, and it predates your time as minister, so I'm not blaming you on this, Minister, but it is a very serious situation. And I have no doubt that during the last 18 months, there has been more pressure put on those services. There's been more pressure put on GPs. There's been more pressure, huge pressure, across every aspect of the HSE. And there's obviously been an increase, and I've listened to the other deputies here relay their stories from their constituencies today, and I can see this is across the country. And that was one of the questions that I asked the GPs at that meeting. Is this a systemic failure, or is this just a failure within Wicklow, do they think? They didn't know the answer to that, and I was wondering, is it just across that community health office 6 and 7 for Wicklow? And I contacted your department on that. And Minister, I acknowledge that you and I have had a number of conversations on this, and I also acknowledge that your office was putting together a comprehensive report back to me on the queries I'd raised in relation to Wicklow, and because of the cyber attack and the difficulties experienced there. So I totally accept that, and I want to thank you for the time you've given me on that, and I look forward to that report. I look forward to being able to go back to the GPs in Wicklow to say that Minister Mary Butler is on top of it. She knows what needs to be done here, and I understand that you've met a number of and had a number of meetings. And I look forward to be able to go back and say there is a solution to this, whether that's a recruitment across psychiatric and psychology services, but to clear that backlog that's there, and then to have a system that functions properly, that people will go in and be seen in a timely manner. Because as we know, with every medical condition, whether mental health or physical health, it's timely interventions, it's early interventions that give you the better outcome. And the longer you leave something run, as people are experiencing on these very long waiting lists, the less likely there's going to be a good outcome from it. So I thank you, Minister, and I wish you luck with your work. And if you could also pass on my thanks and gratitude to all your staff in the HSE for the work they've done over the last 18 months. Thank you, Cian Corla.